Hi, I'm Sue Cooper, and today we're talking with the intention of well-being as a skill, learning skills that will help us stay well, stay vibrant, and talking to James Booth tonight or today is about how we can maintain exercise, movement, posture, spinal health. So James is a great friend. He's also my osteopath, who's kept me on the road for a good few years, keep trucking along. And James, we've had some incredible conversations about what people and what I can do, what other people can do to maintain that integrity within the spine for movement. So I wondered if you would introduce yourself, maybe to begin with, explain what a registered osteopath is, and then go on to what it is you do. So may I hand over to you?
Yes, thank you very much for having me. It's a real pleasure to talk to you. So yes, I'm an osteopath and registered osteopath, and in this country, in England or the United Kingdom, osteopaths have to be registered with the General Osteopathic Council, and we are primarily concerned with improving and ensuring people's muscular-skeletal health. So our major focus is on improving the way people move, relieving or reducing obstructions to good health, and giving them the advice both in terms of the exercises they can do, but also the sorts of lifestyle changes that they can make to optimize their health, and particularly in relation to the muscular-skeletal system. I've been in practice for 24 years, 10 years of that working in the spinal units at the Queen's Medical Centre in Nottingham, with a group of spine surgeons, and that part of my health care career focused very much on people with severe spinal pathologies, and it became more and more apparent to me that we were dealing with people who are at the end stages of their spinal health, and that we should be trying to do more to prevent people reaching that point. So more and more of my focus has become about what we can do to help people stay healthy, prevent the onset of spinal conditions which lead to poor spinal health, and ultimately on occasions to surgery or spinal injections. So we as osteopaths are focused mainly on helping people to improve their movement, reduce and remove obstructions to good muscular-skeletal health.
And that's really clear. Could before you go on to explain actually what you do, what's the difference between an osteopath and a chiropractor and a physiotherapist, so that we can really, what we need individually, we can route ourselves to. So what are those differences?
Yeah, it's quite a common question, and it's actually a really difficult one to answer, because there are significant differences between osteopaths within the profession as well as between chiropractors within their profession, and the same with physios. But I think essentially what it boils down to is that the focus of your treatment. So physiotherapy is very much an exercise-based treatment where the physiotherapist will use exercises to improve strength and flexibility and function. Osteopaths and chiropractors tend to be more hands-on in the way that they treat, using more manual therapy. But again, the focus is about improving musculoskeletal health. And we do try to, well, I certainly try to incorporate exercise as part of what I do for my patients. So I think essentially it comes down to what you as an individual, as a patient, are looking for, whether you want a very exercise-based approach to your care, or whether you like the hands-on aspect of treatment. There's nothing wrong with having hands-on treatment, as long as you don't become dependent on that treatment, and to have regular treatment without considering what you can do for yourself. We try and encourage independence in healthcare, so that you're not dependent on somebody else to ensure your well-being. My focus of treatment, so I try to look at a patient as a biopsychosocial being. So think about their healthcare. That's the psycho bit. In terms of the mental health, the well-being factors that may lead to poor health, such as stress and anxiety, poor mental health issues. The social aspects are lifestyle factors, employment factors, but also home and relationship issues, which may contribute to their well-being. And then the bit that we also really focus on is the biological, so the muscular-skeletal system and what we can do in terms of improving the way their system functions.
And thanks, James. Do most people come to you because they've got pain or lack of mobility? And what is it that you offer to relieve that?
So yes, pain is the primary driver for people to seek care and help. Some people do recognize that their body just doesn't feel quite right and they need some help to improve that. But more often than not, the thing that drives people to seek care is that they're in pain. So pain is an important factor in considering what we do to help them, but it's not our primary focus. The primary focus is to improve the function of their spine or the shoulder or the hip, wherever their problem may be, to improve their strength, their flexibility and their movement. And then you often find the pain is resolved as a result of having done what you've done. So what we don't try to become too focused on the pain, because if your primary focus is on getting rid of pain, then sometimes you can miss some of the factors that are contributing to the overall condition. So look at the patient as a whole, and the pain will go when you resolve the issues that the patient presents with.
And that's the holistic lifestyle view that you do so excellently. What do you recommend in terms of exercise and movement for many people? Is that a recommendation?
Yes, I think ultimately we are mobile beings. We're designed to move, and the longer we can keep moving for, the better. I always, when I talk to my patients about growing older, I always say that growing older is a bit like jumping out of an aeroplane. There's only one direction you're going to travel in, and we can't do anything about that. We are going to fall to earth if you jump out of an aeroplane, but what we can do in order to improve the rate at which we fall or slow the rate down is to release parachutes. And getting older is a bit like releasing parachutes. You release your parachute of strength, flexibility, balance, and coordination. And by doing those 4 things, you can reduce the rate at which you age, but also when you do eventually get to the ground, it's a softer landing and hopefully a little bit more comfortable on the way down. So I try and focus on exercises which help people with those 4 things, improving their strength, improving their flexibility to a functional flexibility, so they have enough flexibility to do what they need to do on a day-to-day basis. Looking at their coordination, because that's very important as we get older, to ensure that we reduce our risk of falling, and then ultimately balance as well. And so exercises like yoga, Tai Chi, Qigong, Pilates, those are sorts of exercises which help all of those aspects of our physicality, but anything that you enjoy doing, really, walking, playing tennis, going to the gym, swimming, they're all things that improve your flexibility, your strength, your balance and your coordination. So I think what's important is that people do exercise that they enjoy. They're more likely to continue to do it and to sustain their involvement. So the focus for me is on something that encourages those 4 elements, but that they really enjoy and that is sustainable.
And it seems to me that a lot of the Eastern traditions, the balanced movement of yoga and Tai Chi, as you're talking about, are the ones that are great for starting to build your resistance and your flexibility. Health promotion. This is what you're talking about, isn't it? This active participation between patient and professional. And I know for myself that what you're so wonderful at from a personal perspective is creating the space, the safe space where you don't get 10 minutes, you get agree half an hour, where you can really start to develop a relationship as well, that conversational. How do you feel about that? That 10 minutes that you often have to get with a GP. No, I'm not trying to in any shape or form disregard that, but sometimes we need a little longer, don't we?
We do, and I think the problem is that in some respects, healthcare has become quite transactional. You know, you go in to see your GP or your healthcare professional, and it's a very quick conversation, and they're very focused on the one thing that you've gone to speak to them about. And you know, we're not made up of individual parts. We are whole beings, and as I say, there's a psychological element, there are social elements that need to be considered as well. And you know, I'm a great fan of the NHS. I've worked in the organisation, and I believe that it plays a fantastic part in the healthcare of the nation. But it's almost as if people have become a bit passive with their healthcare, and they've handed over the responsibility for their personal health to the NHS, and it's the bit that we've got to kind of wrestle back and understand that we have our own personal responsibility for our health, and the NHS is there to support us when that fails or when something goes wrong. The emergency care, medicine, you know, is an example of that. But you know, I think lifestyle medicine has a huge part to play in maintaining and ensuring good health. And I don't feel that there's enough focus from either the NHS or from us as individuals on what we can do in terms of our own healthcare, and lifestyle changes, nutritional factors, exercise, and taking personal responsibility for our healthcare are all things that we should be focused on. And we only should be relying on the NHS when somehow that system breaks down. So, you know, I'm a big advocate of asking people to take personal responsibility for their health, do the exercises, eat well, sleep well, take care of your mental health, and create space for people to explore all of the ways that those different elements of well-being and healthcare can impact their physical and mental health. Yes,
it's and it's that safe, supported space in which you're deeply cared for and you're heard, and the advice is individualized. Just in conclusion, would you again say those 4 elements, repeat those 4 elements to maintain good physicality?
Yes, so strength. You know, and that doesn't mean necessarily pushing weights, although weights can be an important part of that. Body weight strength, doing exercises where you're squatting, lunging, doing gentle press-ups or tricep dips, that kind of thing can be enough to maintain strength. Flexibility, and again, it's an important functional flexibility, not necessarily being able to bend down and touch your toes with your knees straight, but having enough flexibility to put your socks and your shoes on, or to get up off the floor, or to reach behind your back. Coordination, which is, you know, maintaining an ability to function with your arms and your hands and your feet, so that you can maintain the movements that you need to be able to look after yourself. And then finally, the balance element, which you know, ensures that you don't fall, and if you start to trip or stumble, you can recover yourself as quickly as possible. But also you can get up off the floor if you are on the floor. So it's all about functional strength, functional balance, coordination, and flexibility, so that you can achieve what you need to achieve on a day-to-day basis.
And maintain independence, and knowing that the support is there as and when you need it. So personally, I'm incredibly grateful that I found you. I'm very grateful that you're sharing the work of a registered osteopath. And James, thank you ever so much. The work that you're doing is really helping people to maintain that active lifestyle with, you know, pain relief. And I do know, you know, that when you do the gentle movement, the manipulation, you can feel yourself relaxing into it, and then know that the prescription of the lifestyle that suits myself, you know, your patients, is one that will keep us active. Once the spaciousness has been created through the movement, then doing our own exercises. So yeah, I'm really grateful, and thank you ever so much for chatting to me tonight.
You're welcome. Thanks, Sue.